All right, we're going to get started now. So welcome everyone. Thanks so much for joining us. We are here in webinar one of a series that is called Empowered Peel Communities. Uh, this series is brought to you by Peel Multicultural Council in partnership with the consulting group Amplify Engagement, with funding provided by Canadian Heritage. Today is the first webinar in our series, like I said, the first of three, which is entitled Championing Peel's Resilient Community. So we're very excited to share with you and to hear from you. Before we begin into the webinar's content, we would like to do a land acknowledgement, which I will share with you now. This is a way to ground ourselves at the start of any meeting or session we have, both amongst our organizations and here with you today. We want to acknowledge that the land on which we gather and which the PMC operates, Peel Multicultural Council, is part of the treaty lands and territories of the Mississaugas of the Credit. In particular, we acknowledge the territory of the Anishinaabeg, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit, which lived here in the space we now call Peel Region. We have a number of partners that make this project possible, and I wish to, no pun intended, amplify them here today. We have our project funders with Canadian Heritage, and then we have the different supports from Peel Multicultural Council, or PMC. Naveed Chowdhury is the Executive Director, Jagdeep Kaly, Settlement Services Manager, and Linda Wang, you may see her right now in the gallery view or the speaker's view, Community Connections Coordinator. Myself, I am one of the consultants to support this project. My name is Rahul Mehta. And we also have Amplify Engagement, as mentioned earlier. We have Saskia Kwan and Janine Paul, both principals of Amplify Engagement, who are here with us today. And we also have Fatima Khan, Communications Specialist at that organization. So let's continue to some housekeeping before we get into the content. We want everyone to share. We want to hear your perspectives and ideas. We want you to add to the conversation we're having today. But please keep your comments and feedback respectful. You can join us in the chat, but especially in the Q&A. Ask us your questions and share your perspectives on issues or solutions that you have come across in empowering our Peel community, building a more equitable community here. You can add your questions anytime during the webinar. And Saskia and Janine will be taking a look, and we'll have lots of time for a Q&A towards the end. If there's anything that's confusing or that you don't understand, if you see any issues regarding sound or video, please let us know in the chat as well. We're happy to address that as we go. The webinar portion, which is happening right now, will be recorded and shared on the Peel Multicultural Council YouTube channel. So for transparency, we want to let you know it is not recording any of the attendees here. So your name, your audio, your video is not being recorded. And to ensure we have a safe space to share, we will not be recording the Q&A which follows. So that will not be posted on the YouTube channel afterwards. So we really do encourage that discussion. So let's talk a little bit more about the project for those of you that are new, and welcome. This project has really been looking at what's happened over the period of the pandemic. We've had the media and the public often describing Peel communities, in particular, unfortunately, in racist and stereotypical ways. And evidence shows that it wasn't so clear, so obvious as to why it was happening. What we found out since is that the higher rates of COVID-19, when they did occur in Peel region, were a result of different inequalities and injustices among these local communities. So this project, is meant to really empower and amplify the perspectives from Peel, from the community members themselves about racism they may have faced during COVID-19 and the pandemic, and challenge these narratives and look at solutions towards preventing such a portrayal in the future. This webinar series continues that. So we've heard from members of the community. We wish to continue that conversation, and we'll be sharing reflections that we've gathered so far as to why these racist representations occurred and what changes the community members have shared so far that they wish to see for a more equitable, and respectful society. What I want to do now is explore some of the feedback we've heard from these focus groups, and this being the first webinar of 3, you will be hearing from the community members in this first session. We broke down the focus groups we had into some key questions, going from what were the portrayals as to why they happened, and then looking towards solutions or ways to learn from said portrayals. So the first question we were looking at was, were there any stereotypical and racist behaviors, attitudes, or media stories that led you to believe that minority racialized communities in Peel were overly targeted during the pandemic? We were hearing from community members from Mississauga, Brampton, and Caledon, all of Peel region. And we heard in particular from 3 cultural groups. We were listening to the Black community, the South Asian community, and the Chinese community. And they provided a lot of interesting nuance as to what particular communities were facing during this pandemic. One of the most, it may be obvious because you heard of it in the media, but one of the most prevalent concerns was that this is a Chinese virus, both in the name and the portrayal of the location. And for many people, this was tying a population, including people who live, in Canada, who may be newcomers, who may be immigrants, to a global virus. And for many people, this immediately was a barrier to engaging in a positive way with these communities. So for many, we heard this was really a barrier in terms of interacting even and having a positive conversation. Many who would hear or see members of the Chinese community might purposefully avoid them because of this false association to individuals, to neighborhoods, to businesses. And so it became not just a label, but a systemic impact to the community. There are, of course, a diversity of cultures in Peel region, and cultural differences in the pandemic were also a challenge in terms of how different communities interpreted each other and how media portrayals interpreted these communities. So we'll give you a few examples today to highlight some of the responses community members provided to us. For example, in more Eastern, Asian cultures, mask wearing is used often to prevent getting sick. And this is commonplace well before this pandemic, as community members shared with us. And it was naturally for these community members something to practice here and continue to practice during the pandemic. Unfortunately, a lot of community members were sharing that this, again, led to a barrier in positive conversation, in positive behavior around them, where many considered it a insult if someone was wearing a mask around them, or a sign of sickness rather than a sign of trying to prevent sickness, trying to protect one's health. There was a particular story provided of an Asian-based company that took precautions early on, and local employees were complaining because masks weren't acknowledged by the government, and it put the employees in an uncomfortable position because they felt like they didn't have the support from local governments, local government representatives, to practice what they considered something in their best interests, something for their safety. Of course, many in the community, and something we want to continue hearing, is what were your personal experiences of discrimination and racism in the public? These can often be very personal stories. One of the more, prevalent in the media, as has been shared by the community members, was the prevalence of Asian hate or hatred towards a cultural community because of association to negative health outcomes, so negative outcomes in this pandemic. What was heard, especially between the South Asian and Chinese communities, was a portrayal of sickness or disease being, just from the beginning, more likely and more common, and therefore a reason to, again, as we said earlier, not support certain parts of the community, certain businesses, even when those communities may be the ones which needed it more. We were given examples of in the South Asian community, for example, certain businesses which may be more dependent during the pandemic period, such as delivery services, were not only portrayed more negatively because of the communities that may be more commonplace, newcomer communities and South Asian communities in that workplace, but they were also not supported. And we'll come back to some of the supports the community members were asking for in these discussions. The job impacts, the economic impacts that were shared as concerns of how people were being discriminated against was also repeated between newcomer versus what we would say established, those who have been here for a certain number of times, certain number of years or generations in the community, what we've written here as established Canadians. Some community members would share that they were further marginalized or isolated because there was an association of, if you were just recently coming here, you are less likely to have knowledge or ability to follow health outcomes, the health best practices. Again, as some community members mentioned, despite the irony of some people already being masked, already wearing masks before the rules suggested or enforced it as such. So there was a feeling that, as our community members shared, you were treated as lesser if you were a new Canadian during the pandemic. And if you were coming to Canada in the pandemic itself, you were considered to be someone that people don't want to be around as much, that people don't feel comfortable being around because perhaps you have brought a sickness, perhaps you have brought the pandemic to the country. And this misconception, this targeting of individuals, it further carried through the community, not just from the individual into the workplace and into the portrayals by the media. Many of the participants in the focus groups and the conversations noted that they would often not receive direct acts of discrimination or racism, but they would feel something more subtle. Some members of the Black community, for example, highlighted that it's not as vocal, especially on social media or from politicians, but you still see it in people's behavior or where they don't attend. For example, less support for local businesses run by these diverse communities. Some of the participants also spoke to the challenge of feeling more accepted where they immigrated from prior, despite the feeling that this was going to be a better, safer, healthier, there was various descriptors used, place to live. They didn't feel the supports were there for them. The stereotypes, as we've talked about here, they've transcended many different categories of society, many different areas. So not just at the home, not just outdoors, but in the workplace, in the media. And the second question dives deeper into this, into the why these portrayals were taking place. As we noted in the start of this session and in the focus groups, it can sometimes be challenging and uncomfortable for the community members to share their stories. And this was true throughout the pandemic. It was also true, in the focus groups, encouraging people to share. And we encourage you through these sessions to continue to share your stories and your response, not just what the challenges were, but what you wish to see moving forward. The second question of 3, again, it goes more into that why. So asking the question, what, in your opinion, could have been the reasons for these stereotypical and racist representations in the community? Here we heard a few things that have already been suggested in terms of how people were impacted. The first was what one might bundle under a type of ignorance. So it could be due to limited information or lack of perspectives of different types of community groups. Within this, there are some nested themes that emerged: social, cultural, and economic. In the Chinese community, for example, and we were hearing this across members of the different community groups, there are already pre-associated stereotypes as to which community might be considered more desirable or which community might be associated with certain behaviors, certain health outcomes during, in this case, a pandemic, and in other cases, access to the resources and supports that they need to manage such a health crisis. All of the communities are speaking to misinformation that was in the media, that was in schools, and even in the workplace, and the dismay that often they weren't hearing positive support from government representation. So regarding government and politicians, many of the community members shared that they have an important role to play, not just for the policies that they brought forward, but also how they showcased support for communities that might be feeling, again, already marginalized, but might be feeling more discriminated against during the pandemic because of some of these perceptions we talked about, such as masking, such as communities which might be associated with higher COVID cases, and workplaces, for example, warehouses, which might be associated with a higher risk of transmission. Many in all of the communities we spoke to said they didn't hear the support and the debunking, so correcting of misinformation in these different environments. So for social people outdoors, social groups, what is the best practices for health and safety? For cultural groups, what are different communities facing in terms of discrimination, such as Asian hate, discrimination towards wearing of masks and certain health measures and health safety measures, and economic businesses which were proactive as opposed to reactive, so taking measures prior to government intervention as opposed to after, businesses that had to stay open. So as you've seen in the news, the example was given of warehouses, of first responder businesses that need to supply PPE, personal protective equipment, and other stores that did not have the luxury of closing because these might have been also lower income communities. Essential services were mentioned as workers that, again, didn't feel like they had the choice, and they often were getting COVID because they had to be at the workplace, as well as international students who were often in again, these same environments that were described as hotspots, which they simply lived. And if they didn't have the supports, they felt they had no choice. I mean, it was where the COVID outbreaks were happening. So there was a repeated concern brought up of, is the government providing enough support, and are they properly influencing perceptions of, how these communities are coping and how they can emerge out of this without being discriminated against, without being further marginalized. And that kind of went to this perception of, we have had stereotypes in these communities before. Peel being one of the most diverse regions in Canada, the challenge becomes, how do we help educate other communities that might not associate with the challenges in Mississauga or Brampton or Caledon because of certain cultural groups not represented in other parts of the country? How does different community groups, different voices in media and government, how did they help debunk and prevent entrenchment, so prevent further stereotypes in the long term continuing? And as the pandemic continues, it's going to be important for us to continue to ask these questions and hear these responses from community members. What do you feel are the long-term stereotypes? And based on your personal story, what do you feel are the best outcomes to prevent them from continuing? Oh, and my apologies, I forgot to go to that last point. So to wrap up this section of what was heard in terms of the why, there was also a mention of media and social media, perhaps unsurprisingly. That is one of the major sources of information during the pandemic, in addition to government officials. And many noted that the media changed over time. Their responses changed as more voices spoke up regarding things like anti-Asian racism, anti-Black stereotypes, discrimination towards the South Asian community. Brampton in particular being labeled as a hotspot was a concern to community members, and this did start to change as more community members spoke up throughout the course of the pandemic, and one would wonder how that's changing still. And this again goes back to why it's so important for us to hear from the community. How are things changing? How has the response changed during the pandemic compared to when you first started to hear certain types of representations in the news? Has there also been representation of your particular community? This was noted within some of these groups, that there was sometimes very limited information around proper use of PPE, proper access to masks and vaccines in groups that were facing higher COVID case counts. It then became a question of, is the media and the politicians, which have the forward face to many of these campaigns on education, are they making sure that no community is left behind? And this leads to what is in some ways the most important for long-term outcomes, the question of what comes next. What needs to change for Peel communities to be fairly represented by the public and media in the future? The focus group participants were also asked, what do people in a position of authority need to better understand about minority and racialized communities in Peel? And again, these questions are also presented to you, our participants, the public here. There were some core themes, like in the previous sections, talking about how communities can be better supported moving past the core of the pandemic. So one of the first things that was highlighted was community voices being better represented, and they were appreciative. And we hope you are too, as you join an increasing number of community voices feeling comfortable to speak up about some of the concerns that they had and some of the changes they wish to see. We heard from the community that setting up groups where more people can meet and discuss, perhaps among their cultural groups within their neighborhood, the issues that they've seen so that they can collectively voice their opinion to government is an important tool, as is having additional, or one would say in addition, having additional forms of communication coming from the communities themselves, as opposed to just from a media outlet or just from a government representative. Many of the community members felt like their voice wasn't always represented fairly, as it was from some of the other groups. There was also then, of course, the challenge that was brought up of international students and students in general facing hardship during the pandemic. In Peel, as participants here may know, there were sometimes longer closures of some of the school systems, of some of the workplaces. And so the educational and economic supports, as suggestions from the community, came from these realities. In regards to educational supports, there was discussion around making sure that there is more information to young people in the community having access to PPE, and also education in the sense of actually communicating why it's important to have access to these supports during the pandemic. So there is less skepticism when members of the community were seen, for example, wearing masks, and there was more trust that this is the right thing to do. The same was said around education through the school board and on the virus itself, how it's changing. In regards to economic supports, there was some additional points made regarding how there can be better supports for some of the workplaces that had to continue to stay open. And for those that were maybe not facing the same lack of resources. So for example, supports for renters of businesses, supports for those working in warehouses, and supports for education in these spaces, again, so that those who had to go work in these areas that may have been a greater risk had access to the personal protective equipment that they needed. There was also a mention of increased accessibility, where members of the South Asian community, for example, didn't always feel the same accessibility for jobs that would be in a lower risk environment or that would be of sufficient support to them. In regards to political or government support, it is really tied to many of these themes of education. There was concerns around, is there enough information being provided from government officials as to how these communities can manage the pandemic in the short term and the long term? How do we respectfully treat these communities and break the stereotypes from the higher levels? So not just from the community level, but from levels of government. What are local politicians saying to build trust and support for communities that may be facing discrimination and portrayal of different stereotypes during and after the pandemic? The same was said for media. What is the role of media in addressing the stereotypes which occur both within media itself and debunking them to help the public understand what is the reality of why, for example, Brampton was labeled as a hotspot community? In addition, there was also a question of, is there a need for greater regulation to understand, when media does something wrong or when a level of government does not communicate any, for example, racist or hateful behavior? If that information is put to the public, how is it corrected? How is it addressed by levels of government and levels of media? Should there be more regulation? And these ideas coming from the community members from a diversity of ages and backgrounds, it is how Peel can emerge as more empowered and more connected to one another, understanding what the challenges were and continue to be, and how different parties that portray, educate, and work in media or government can support them moving forward. That was just a small snapshot of some of the community voices that were heard so far in this project. You can further continue the conversation online, a conversation on solutions and thoughtful perspectives. We really want to encourage more people to speak up. You can find Peel Multicultural Council social media here and the hashtag Empowered Peel as a way for you to communicate some of your concerns and solutions and best practices. Thank you so much, everyone, for joining us in this webinar. And thank you, of course, to our partners at Peel Multicultural Council, Amplify Engagement, and Canadian Heritage, the funder, for making this project possible.